Now that we've discussed the history of epidemiology, in this lecture we'll define epidemiology and how it fits into public health. After you have reviewed this lecture, you should be able to complete the following learning objectives. Define epidemiology, list the uses of epidemiology in public health, and describe how epidemiology supports improving the public's health. There are many definitions of epidemiology. It is thought that in the mid-19th century, the word epidemiology was first used to describe the scientific study of epidemics. For this course, we will use the following definition. Epidemiology is the study of the distribution and determinants of disease or health outcomes in specified populations and the application of this study to the control of health problems. The meaning of epidemiology has expanded over the years, and present-day epidemiology encompasses the study of all varieties of illness, health outcomes, and injury as they affect populations. Next, we will learn about how epidemiology fits into public health. For example, epidemiology has been used to evaluate the success of immunization programs such as the one being implemented here in Mogadishu. Public health is a multidisciplinary field whose goal is to promote the health of the population through organized community efforts. Public health protects against threats to health, empowers people to lead healthy lives, improves the quality of health services, and prepares leaders to advance health. Now let's discuss two aspects of public health where epidemiology is used. First, prevention, such as raising public awareness about the need for child car seats, and interventions, such as promoting healthy eating by lowering the cost of healthy foods. Epidemiology is used to develop, target, and evaluate prevention strategies. There are 3 levels of public health prevention. Primary prevention occurs before a person gets a health outcome and tries to prevent the health outcome from occurring. Primary prevention may reduce the prevalence, risk, and/or rate of a health outcome. An example of a primary health prevention is vaccination. Vaccines prevent diseases from being contracted. Secondary prevention occurs after a disease has occurred, but before the person notices symptoms. Secondary prevention aims to find and treat disease early, which may lead to the disease being cured. An example of a secondary health prevention is a doctor checking for suspicious skin growth in order to detect and treat skin cancer early. Tertiary prevention refers to a person who already has symptoms of the disease. The goal of tertiary prevention is to prevent damage and pain from disease, slow down disease progression, prevent complications, provide better care, and help people recover. An example of a tertiary prevention would be offering dietary advice to help manage the symptoms of diabetes. Epidemiology is also used to evaluate interventions in the population. Public health interventions can occur at 2 levels, individual or structural. Individual interventions focus on changing individual risk factors or behavior. Individual intervention approaches rely on the assumption that people have the autonomy and capacity to make choices and then follow through on their choices. An example of an individual intervention might be educating individuals on the health benefits of quitting smoking. Structural interventions focus on changing physical, social, and/or economic factors in the environment to improve public health. Provision of clean drinking water, improving road safety standards, changes in car designs, or changes in urban design to increase physical activity are examples of structural interventions. In contrast to an individual intervention, a structural intervention to prevent smoking might promote taxation of tobacco products to make them less affordable. Structural interventions rely on the assumption that public health problems have some social causation. Public health is preventing illness and disability and prolonging life, promoting physical and mental health and efficiency, community efforts for sanitation of the environment, prevention of diseases and injuries, education of the individual, organization of services for the diagnosis and treatment of disease, and promoting a standard of living adequate for the maintenance of health. These points were taken from a C.E.A. Winslow quote on public health. Epidemiology is used to describe and evaluate each of these points. So, epidemiology is the study of the distribution and determinants of disease or health outcomes in specified populations, and the application of the study to control health problems. Now that we understand epidemiology in the wider context of public health, we will discuss the person, place, time, and the population perspective of epidemiology in the next lecture.